Generally, pus discharge from the ear comes either from the external ear or the middle ear. So the very common causes for the pus discharge are if the person is having frequent cough and cold, they can develop infection of the middle part of the ear that can discharge outside by having a hole in the tympanic membrane. Sometimes the external ear is having fungal infection or some kind of bacterial infection that can create the problem of the discharge in the ear. So if the discharge is coming for very short duration of time, it is an acute infection that is generally managed with the antibiotics or anti-inflammatory painkiller drugs. If the discharge patient is having discharge for the long duration, they need to be taken care specially, and they have the different treatment options. If the person has noticed the ear discharge is coming from his or her ear, he should immediately go to an ear specialist and get it checked, because sometimes the problem can be cured at very initial stage. If the person detects the ear discharge in very acute stage, that simply can be cured with some simple antibiotics or the anti-inflammatory agents. If the person is having ear discharge for very long duration of time, generally these ear discharges are cured with the antibiotics, but there are generally damages in the tympanic membrane, or sometimes there is defect in the bone. So these cases require surgery. Otherwise, the problem of the patient can exaggerate and he can develop the complications. First of all, ear discharge must be evaluated very carefully by an ear doctor. If the discharge is coming for the short duration of time, we generally give the person very simple course of either oral antibiotics or some ear drops which contain the antibiotics. So generally within few days the ear discharge gets subsided. After that, patient need to see to the ear doctor again if the problem is temporary or permanent. If the person is having the ear discharge for very long duration of time, say for example 3 months or more, then it is a chronically discharging ear. These cases generally have hole in the tympanic membrane, or sometimes if there is foul smell from the ear discharge, there could be the damage in the bone of the ear. So these cases require surgery at a later stage. Otherwise, patient's hearing or other problem, hearing can be at danger, and patient can develop other problems like some facial nerve paralysis, some permanent problem of the dizziness, imbalance, or sometimes the infection can spread to the neck or the head area. That can create complications. If the person is having infection or some irritation in the outer part of ear, we advise patient to simply wash the ear with the plain water or soap, and then he can use the simply coconut oil to apply on the outer part of the ear. We generally do not recommend person to put anything inside the ear. Like people use mustard oil, some natural Ayurvedic preparation, Ayurvedic formulas. So all if the person is using all these natural things or oil, they get stuck to the very thin tympanic membrane, and that can create a problem of the hearing loss, and patient can develop the fungal infection also. So generally we do not advise person to use any home remedies. If he or she is having any problem, he should visit to the ear doctor, because generally ear do not require any specific treatment. They are get cleaned by themselves. There has been a practice of using the hot oil, particularly mustard oil, inside the ear, but this is not recommended to use inside the ear because of the two issues. If the oil is very hot, it can burn your tympanic membrane. Second thing, if the oil stays inside the ear, and on the next few days, if you have the water inside the ear because of the bathing and because of any other issue, the oil and water get mixed up, and that can create a problem of the fungal infection. Another thing is, if the person is having hole in the tympanic membrane and you put the hot oil inside that can create complications. Sometimes the person is having traumatic perforation in the eardrum and he uses the hot oil. That can complicate the situation, and person might have the permanent hole in the tympanic membrane that is cured only with the surgery. So hot oil is not recommended to use in the ear.